Good afternoon. Thank you for joining us today. We have a lot of ground to cover today, and through the modern marvels of technology, we're going to be able to do just that, even geographically speaking. But we'll start with Dr. Box, the State Commissioner of Health, for an update on what you've seen over the last 24 hours.
Thank you, Governor. Today, unfortunately, we reported an additional 34 Hoosiers who died of COVID-19 that was reported to us in the last 24 hours. These individuals ranged in age from 37 to 97, and the majority of them died between April the 4th and April the 6th. As the governor noted, we now have had 173 Hoosiers lose their lives to this novel coronavirus. To put this in perspective, on average, over the last 5 years, we've only lost about 150 to 160 Hoosiers in a 7-month period of time to influenza each year. These numbers change daily, and I want to brace you to see them increase as we get closer to the peak of this disease. I also want to reiterate how we announce the deaths. The numbers we release each morning is based on the results reported to our database as of 11:59 the previous day in the evening. Sometimes we're notified by phone of deaths before they arrive in our database, which you saw yesterday when we reported on the Madison County Long-Term Care Facility. Our goal is to provide you with the most current information that we have during our morning dashboard updates and again at these briefings. As the situation changes quickly, that will mean that sometimes our dashboard is still catching up. Our long-term care facilities continue to be a big concern. In addition to the 11 residents of Bethany Point in Madison County who have died, we are aware of another facility in Madison County with 4 deaths which appear to be COVID-related. There have also been 4 deaths in a long-term care facility, as I mentioned yesterday, in Johnson County, and 3 at the facility in Lawrence County. If a long-term care facility has a known or suspected COVID-related death, those should be reported to the local health department and to the Indiana State Department of Health within 24 hours of that death. In addition to residents, facilities should also be reporting on any employees who test positive. Our strike team is going out every day and testing more individuals in these facilities, and we expect to be able to share more data related to these efforts later this week. Today, we sent 50 additional testing kits to Bethany Point to test more individuals. I also want to update you on our efforts to expand testing in the northern and southern regions of our state. As part of that work, we'll be launching a targeted drive-through testing operation tomorrow at Maryville High School in Lake County in collaboration with the Lake County Health Department. This clinic will be reserved for healthcare workers, long-term care workers, first responders, and essential workers who are symptomatic of COVID-19. We will be sharing times and other details later today. We're finalizing plans to also set up targeted drive-through testing in Clark and Vanderburgh counties later this week. Please ensure that you are a healthcare worker, a long-term care worker, emergency medical system, or one of these essential people, and that you actually are symptomatic to come to one of these clinics. Although we know that there is asymptomatic spread of this virus, we still don't have the ability to test everyone without symptoms due to our limited resources. From a medical standpoint, someone could test negative today, go out, touch a door handle with COVID-19, and be positive within the next 24, 48 to 72 hours, which is why it's critically important that you continue to stay home. Thank you.
Thank you, Dr. Box. Normally at this time of the year, I am out with the commissioner of our Department of Transportation, community by community, awarding funding for our Community Crossings program. This year will be a little different, understandably, and rightfully so. There will be no award celebrations or no ribbon cuttings or launching of balloons. But by law, this funding still needs to get out to all of our local communities, be it counties and cities and towns throughout the state of Indiana, for specifically infrastructure road projects. And at this time, as we move forward, I'm going to ask our Commissioner of the Department of Transportation to address not just the community crossings, if you would, Joe, but also some other infrastructure essential projects that are going forward, so folks know, in terms of traffic counts and construction that's going on all over the state of Indiana, what they can expect as the coming weeks and months unfold.
Sure. Yeah. Thank you, Governor Holcomb. As was mentioned, my name is Joe McGinnis. I'm the Commissioner of the Indiana Department of Transportation. And as the Governor mentioned, it's community crossing season for us, which it was established by the General Assembly in 2017. And it was in an effort to support local units of government as they are maintaining their local infrastructure. Announcing the awards is something that I look forward to, as I know the Governor does every season that we do this. It's a really exciting time at NDOT. But as he mentioned, today is a little bit different, but we want to make sure that we take a moment to honor those communities that are being awarded funds through the matching grant program to improve their infrastructure as we learn each day how critical our infrastructure and our massive transportation system is in the state of Indiana. As of 2:30, the award list has been released to the media and is now posted on our website at ndot.in.gov. A few of the statistics for this year. It is 217 awards were awarded, totaling $126.5 million. The awardees consisted of 61 counties and 156 cities and towns. All of those projects combined will mean 2,085 road segments will be upgraded and 11 bridges will be replaced or rehabbed due to this funding through the matching grant program. I truly look forward to getting out into these communities when it is safe to visit and check out the amazing things that our mayors and county commissioners and town council members are doing around the state and can't wait to see the progress that's being made with these dollars. Also, as I mentioned several days ago, that we are seeing a significant decline, of course, in our road travelers. And so more so now than ever, it is essential that we continue to provide a quality infrastructure network throughout the state. Without it, food and medical supplies cannot get into the hands of the folks that need them. And our traffic engineers have been working daily to track this data provided by our agency's vast traffic counting system. As indicated by the graph, we have seen a significant decline in traffic volume compared to our baseline week of March 2nd through the 8th. Weekdays are typically 40% or more reduction, and weekends are more than 50% reduced vehicle traffic. Now, these are all types of traffic included. Because of this, we are getting a jump start on our construction season and preparing to make additional closures where efficient detour routes allow, providing workers a safer workplace, expedite the project, and in the end, save Hoosiers more valuable tax dollars. One of those such projects is right here in Marion County on I-70 between the North Split and I-465. As was reported recently in the media, the closure will begin next Monday and continue through mid to late May. This will allow the workers and the contractors to work in a safer environment and get the project done in just a month compared to the original 5+ months. Another project that we've been talking about for years now, literally, is I-69 Section 6, one of the projects that we are extremely proud to get going from Martinsville to Indianapolis 465 on the southwest side. The project continues to move forward. Folks in the Martinsville-Morgan County area have started to see road construction signs and barrels arriving on the scene, and road construction equipment also in the area. So please pay attention. Also, additional construction all over the state. We have projects that are letting and rolling right now on 469 in Fort Wayne. We have projects on the Lloyd Expressway down in Evansville, and those are just two of the corners of our state. On a final note, please slow down. I have experienced a tremendous, seen a large uptick in vehicle traffic or vehicle speeds around the state. I know we're experiencing far less traffic, but the speeds have increased considerably. Going 70 miles an hour in a 70 mile per hour zone on a 20-mile commute will only save you 3 minutes. Please slow down. For the safety of all Hoosiers, please watch your speed as we all want to get to our final destinations safely. Thank you.
Thank you, Commissioner. Next, I've asked 3 experienced leaders, 3 mayors representing different portions of our state, southern, central, and northern Indiana. These 3 have been exceptional partners demonstrating the exact kind of collaboration that we need to see ourselves through this time. First, we'll start south. We'll kind of work up I-69. You mentioned I-69. We'll start in southern Indiana, in Evansville, with Mayor Winnicky. Mayor, you taught me long ago that E stands for everybody, everyone, and I can't think of a more appropriate reputation to have than at this time. You want to give us an update on all the progress you've made, maybe not just in your city, but in your region as well.
Absolutely. Thank you, Governor. This is a good time to be known as a community where E is for everyone. What I'm witnessing, yes, anxiety, but more so, I'm seeing a city full of grace and charity and kindness and compassion, and that stretches from the neighborhood to the boardroom. We have volunteers that are helping kids make sure they get fed either in spring break or now that e-learning's back in. We have neighbors helping neighbors. We have health care systems that are collaborating very impressively. We have a city police department that's really stressing social distancing in unique and creative way. We're doing really exceptional work in Southwest Indiana to support our homeless during this crisis. We're raising a significant amount of money to support nonprofits who are stressed. I'll get to more of that in just a bit. In terms of city government, practically every administrative employee is working remotely. We're fortunate so far to only have 2 city employees who have tested positive for the virus, a dispatcher with our transit system and a city police detective. And each of these folks are in various stages of treatment and recovery, where our prayers are certainly with each of them and their families. We have a budget impact as a result of this. The city of Evansville receives about $2 million, about $1 million a month in casino revenue. Since Tropicana and the other casinos have been closed, that's a big hit to our budget. So we have taken to our city council, and the council has approved a $2.8 million repeal to our 2020 capital budget. We're planning for more and hoping for no more. But that is, there's a real budget impact to municipalities across the world also. Of course, we're all becoming very proficient in government at Skype, Zoom, and WebEx. Doing a lot of that these days. You talked about the region, and I appreciate the shout out Southwest Indiana got last week with the COVID-19 Crisis Response Fund of the Greater Evansville region. This represents the best of the best. Our big heart in Southwest Indiana is really shining through right now. We're out to raise $6 million to support nonprofit organizations that are in the human services sector. That is, those organizations that are working day in and day out to lift up our most vulnerable in Southwest Indiana. So this fund will support organizations in Posey, Vanderburgh, Gibson, Warwick, and Spencer counties. We kicked it off on March 27th with commitments of $1.4 million. That was a Friday. The next day, Evansville businessman Bill Stone, very generous to our community, offered a $500,000 match. As of yesterday, we've utilized every penny of that match, and we were most grateful. So we're now just at the $2.5 million mark. Again, to go to organizations that just really do a lot of heavy lifting every day to help our most vulnerable. Very happy with a program we call Need a Neighbor. This matches a person with a need to a person who wants to help fulfill a need. If someone needs groceries, other essential items, perhaps a prayer or a friendly phone call, a referral for financial assistance, this is the place to go. There's a really great website, needaneighbor.org. Someone can go out there and sign up for a need, or someone can do it on someone else's behalf. This is really a great effort of our faith communities and 2 specific nonprofits in Evansville, for Evansville and Community One. In the last week and a half, over 100 special needs for neighbors have been met. So I'm really proud of neighbors coming together to help their fellow neighbors. As I mentioned at the beginning, we're doing a lot to feed folks too. During spring break week, we had volunteers and nonprofit organizations coming together at our community center for grab and go lunches for students. And now we have volunteers and community leaders assisting cafeteria workers in our closed schools to provide to-go meals for families during this pandemic. Really happy with what we're doing to support the homeless during this crisis. We have created a facility that we're calling the Evansville Independent Self-Isolation Center. The City of Evansville and the Catholic Diocese and the homeless service providers in our community have come together to open this facility. So we're using the diocese Sarto Retreat Center. It's a 55-room dorm-style facility on the north side of Evansville. It's a place where homeless people can, who are waiting their COVID-19 test results, can rest and be in isolation. We've had several people in it since it's opened in the last week, but really another strong sense of how people come together, not just in Evansville, but in all of Southwest Indiana. In terms of small business, we're very happy with the partnership with the Southwest Indiana Chamber of Commerce. That organization retooled its website practically immediately and made it all COVID-19 related information. It is really the resource to go to in Southwest Indiana for anything related to SBA or the CARES Act. And of course, there's important information about which restaurants are open for pickup and delivery. In the city of Evansville, we have a small portfolio of loan recipients through a revolving loan fund, and we're working with each of those businesses to defer payments for a minimum of 4 months until we understand exactly how long this crisis will last. Wrapping up here, or about to wrap up, healthcare collaboration, really, really impressive. You have the Deaconess Health System and Ascension St. Vincent and the Vanderbilt County Health Department. They are wonderful partners for Southwest Indiana. Each hospital launched a nurse triage line early in this crisis that was really well received and really was a big asset to consumers in Southwest Indiana. And it also provided a means for healthcare workers to provide testing, but also to limit their exposure to folks who are using facilities. So we're really happy with what they're doing. There's really strong communication between these three entities, the two hospitals and the health department, when it comes to regional asset planning, staffing needs, and other equipment and PPE needs. Last, and I appreciate the shout out from the governor recently on a little project that our police department has done to promote social distancing. If you've not seen it, it will put a smile on your face when you probably need it the most. Go out and do a YouTube search, EPD, and it's to the song, Don't Stand So Close to Me by, of course, the police. It will brighten your day and deliver a strong message as well.
Thank you, Mayor. We're so thankful for your leadership. I know you're taking some heat down there to get a haircut. It doesn't look like you need one. Next, we have the mayor of our capital city, a city known to be the #1 convention city in America, the city that is home to the #1 international airport in North America. Mayor, you have been, you got out of the gate strong. You're the tip of the spear from day one. You haven't slowed down. We've been in constant contact. I don't know when you sleep. I don't think either of us are. But you want to tell us, we just heard from the mayor of Evansville, but there's a lot of good stuff going on right now here in central Indiana as well.
Well, thank you, Governor. First, my thanks to you for the invaluable partnership that the state and the city have enjoyed during this emergency period of time. You know, containing this virus is an act of mass coordination, and it wouldn't be possible without the state's help and the state's guidance. And that, of course, includes you, Dr. Box. Thank you to both you and the governor. It's always a pleasure to be with my fellow mayors. It's also great to be with a former colleague, former mayor. And the truth is, it has now only been a month since our city's first COVID-19 diagnosis. In that time, like so many around the state, We have gone from business as usual to an entirely new way of living. It has not been easy. Some have lost a business. Many have lost a job. Some have lost a loved one. In short order, it has become one of the biggest challenges our state, our city, has ever faced. But the story of Indianapolis and the story of Indiana is filled with examples of how we organize to tackle those big challenges. For a century, we've hosted the world's largest single-day sporting event. We're the town who, through one of the all-time great Super Bowl celebrations. These are feats of civic, corporate, and community organization. And I'm pleased to report today, Governor, I see the same energy on full display in central Indiana. As providers of human services struggle under increased demand, a coalition of local funders, led by the United Way of Central Indiana, announced a multi-million-dollar fund to help service providers continue their vital missions. Now, this announcement was made only 4 days after the first case was announced. Chief among those funders is the Lilly Endowment, whose $15 million contribution to the Community Economic Development Relief Fund will help ensure that our service providers are well positioned to serve our residents throughout this pandemic. Our first responders and healthcare workers are just as vital. Over the past several weeks and in the many difficult weeks to come, these men and women have been on the front lines for our community. The debt of gratitude that we owe to them is impossible to overstate. And that is why I'm proud that our city has partnered with the YMCA of Central Indiana, along with At Your School, Inc. and Early Learning Indiana, to offer discounted childcare for emergency personnel. In addition to the free COVID-19 testing that Eli Lilly has been offering for essential workers, we are doing everything that we can to help our front lines remain strong and supported. It is the least that we can do. And as we work to help business, healthcare, and employees, there is a community that was already struggling before this crisis: those who are hungry. Last month, we launched the Community Compass app, an innovative multi-platform digital resource designed to connect residents to food programs. This platform has become critical for people impacted by COVID-19, helping them to find pantries, retailers, clinics, and more. And thanks to groups like Second Helpings, Gleaners Food Bank, Midwest Food Bank, our city's Parks Department, and our city's 11 public school districts, our food pantries and meal programs are working to stay stocked and staffed. Finally, while social distancing contains the spread of what is, for many, a deadly virus, the limitations it imposes on small and local businesses can be devastating. In response, local stakeholders, in partnership with Indy Chamber and the City of Indianapolis, have assembled emergency funding to keep small businesses afloat. As any community knows, the small business ecosystem is often what makes a town unique and what keeps our economy strong. We are going to need these businesses, but for now, they need us. Governor, as you know, I could go on, a corporate community stepping forward in unprecedented ways, a philanthropic network lifting up those most in need, leaders at the federal, state, and local level working to combat a virus that respects no borders, class, or ideology, and most importantly, the thousands of Hoosiers taking precaution to slow the spread and flatten the curve, easing demand on healthcare workers and protecting our most vulnerable. When times are tough, Indiana is at its best. And I'm proud to report that in Indianapolis, we are doing our part to help our fellow Hoosiers get through these dangerous days.
We're proud. Thank you for your ongoing leadership, Mayor. And batting cleanup, if you will, we have the Mayor of Fort Wayne, Mayor Tom Henry. Mayor, you seem to find your way as a top-ranked city in America to raise a family year after year after year, and we appreciate your leadership as well. And you were one of the first out of the gate to start the Fort Wayne Wave, or Wave Fort Wayne, and just express that neighborly conduct. Do you want to give us an update on what's happening on the ground there in Allen County and the whole region?
Well, thank you, Governor. Thanks for giving me the opportunity to say a few words to not only all of those who are listening, but to also share the space with some of the finest mayors in the state. Both of them are just outstanding individuals, and I'm very, very humbled to be a part of that group. In fact, all the mayors that I've been talking to over the past several weeks, all of them are so sincere in their quest to make sure that their cities remain as safe as possible. It's really uplifting and very humbling. In the city of Fort Wayne, though, what we have done is we realized, as my colleagues have said, the challenges in this particular environment are numerous. So what we decided to do in Fort Wayne was to try to simplify it as much as possible so we could get our arms around as many of the challenges as possible. So what we've done is we've created a communication strategy. We identify communication as the primary tool that we needed to use to make sure that our community stayed abreast of what was going on throughout not only Fort Wayne and the county of Allen, but obviously the state and to some extent the federal government. So what we've done is we've created a number of task forces to identify three major areas. The first one is the communication dealing with the coronavirus itself. And what we've tried to do is to keep our citizens constantly aware and updated as to the COVID-19 situation in the city of Fort Wayne. We release to them almost daily what the stats are in the city of Fort Wayne, how many people have been tested, how many people have been tested positive, how many unfortunately have died as a result of COVID-19, and not only Fort Wayne, but Allen County itself. We also constantly reiterate your request to make sure there is safe distancing, that people do wash their hands as much as possible, that we have access to hand sanitizer, that they stay at home. And I don't know how many times we have pleaded with our citizens, stay at home. In fact, a few times I myself have stole away from my home to drive around to see if there were any people outside and in fact what they were doing. And quite frankly, if I saw a group of people walking down the sidewalk together, I would pull over and ask them why they were out. Why weren't they home, not only protecting themselves, but other citizens as well. So we have that whole strategy in place of communicating with the general public what's going on medically in our community as a result of this virus and what to do to not only protect yourselves, but to protect others as well. Our second communication strategy has to do with identifying the needs and wants of our community. We actually did a survey through our health department to try to identify what people really were asking for in our community as far as trying to grapple with this particular virus. One of the major concerns was healthcare. They wanted to make sure they had access to healthcare, affordability, and what to do in an emergency situation. Would they have access to our Three Rivers ambulance service and so on? So we've had a number of opportunities presented to us to get that word out, either through social media, through our electronic media, through PSAs, through actual PSA programs, the written copy. So we've used a lot of tools in our communication toolbox to make sure that people were acutely aware of what was out there to help them with their healthcare needs. But we also went further than that, because we realized that people are still trying to get their head around the availability of food and housing in our community. For those who are homeless, how do they deal with this? And what do social service agencies do in order to work with those who, many times through no fault of their own, are left without housing? So we try to go through a number of these different needs and wants as identified by this survey and by our professionals, and try to put together action plans to work with each one of those identified areas. And again, we have sub-task forces working on those particular areas. And I've been really humbled and honored at how many people in our community have really stepped up and volunteered to be a part of all of these task forces. It's been an unbelievable outpouring of people with compassion and caring about their fellow neighbors. It's really been enlightening and heartening to have all of these people call and contact us saying they want to be a part of working with this community to try to combat this particular virus. And finally, our third communication strategy is called In This Together, a communication objective. And that is to let the citizens of Fort Wayne know that, yes, this is a serious situation. Yes, we have some serious problems and challenges that we're trying to again, get our arms around, to develop strategies to deal with those. But at the same time, we can't forget that we are a community. Governor, you mentioned, and you've given us a couple of shout outs dealing with one of our action plans, and that was at 7 o'clock in the evening. We asked everybody to come out of their homes, stand on their front porch, stand at the edge of the sidewalk, and wave to each other in their neighborhood, letting each other know that they are neighbors and that we are all in this together. And what a tremendous outpouring. Even in my neighborhood, about 3/4 of our neighbors come out. Some of them aren't quite there yet, but about 3/4 of my neighborhood come out and we wave, and numbers of pictures are taken on cell phones so that they can share it with others. But we've also gone further than that. Some of the neighborhoods have decided to mix some of their exercise and recreational programs with this connectivity. So we have one major neighborhood where they've shut off the street, and they now actually have Zumba classes on the front porch, on the sidewalk, and sometimes in the street. And they practice safe distancing, but they're all in this together. And it's a wonderful thing to experience. In fact, one of our national network stations picked it up, and they've shown it a number of times as our community is showing coming together and trying to experience this idea that, we're all in this together, but at the same time, we can practice safe distancing and other elements of trying to be alone, yet be together. But we also have a number of other things that have happened in our community. We've had some major donors in our community order and receive now over 10,000 surgical masks and N95 masks from other countries in order to help us, in our effort to fight this. Our hospitals seem to be doing relatively well in their inventory, at least for the time being. But many of our social service agencies, our home healthcare programs, our community food banks, and others have expressed a need for masks. So we have had some donors step up. And our sister city, we have a sister city in China that has volunteered to put together 10,000 masks to be delivered to our city. So that's going on as we speak. And at the same time, we've had donors step up and they're donating hand sanitizer, many of them in the 4-ounce containers for individual use. And now we're getting 16-ounce containers to put on in nurses' stations and the like. So we have a lot of that type of activity taking place as well. But the one thing that really has been something that I'm exceptionally proud of, and I believe both mayors indicated this as well. It's the outpouring of our citizens to make sure that others are taken care of as far as basic needs. We've had food deliveries taking place. In fact, at one of our restaurants in town, even though they still can do carry out, they have been offering free meals. It's a restaurant called Umi, and I don't have any problem giving them a shout out, but the Umi restaurant has given away over 6,000 free dinners. All you have to do is drive up and ask for one, and they give it to you, no questions asked. Talk about an outpouring of caring and compassion for our citizens. So that's something that, again, is very humbling as far as being a mayor. So, Governor, those are the 3 areas of communication that we've identified as the umbrella strategy for our city. We try to make sure that your message and the message of others are put into play as far as constantly reminding people what they need to do to take care of themselves and others. We have a strategy for communicating with our citizens as far as trying to meet their needs and wants. And finally, we continuously emphasize the fact that we're all in this together.
Well said and well led, Mayor. Appreciate it very much, the collaboration and your team effort up there. Just proving that, and I'm wearing the T-shirt that says "In This Together." And we may be apart, but you remind us that we can still do yoga together, I guess, on our front porch. I wanted to, before we get to the questions, and we'll get right to that. By the way, the 3 mayors will stay with us. They've carved out this hour. So they'll be available for media inquiries as well. But I just wanted to underscore a quick point. I made the point yesterday not to compare the common flu to COVID-19, and you heard Dr. Box underscore that again here today. And I didn't want that lost on anyone, what she just said. She just said that over the past 5 years as a state, we have averaged 154 flu deaths, 154 each year for the last 5 years on average. And now we are over 100, we're at 173? 173 deaths for COVID-19. The flu season is around, I think, 7 months, kind of mid-October to early May. We've done this in 3-4 weeks. And so that shows you, and by the way, COVID-19 is on top of the flu. We didn't get rid of the flu. We're still, our healthcare workers in our hospitals and our clinics are still dealing with the flu. They're now dealing with both. And so that's why we've taken all these extraordinary measures to try to keep folks safe and to mitigate and to flatten the curve and to spread this over time so that our healthcare system doesn't collapse. That's the whole reason why. Dr. Box, General Lyles, Steve Cox at Homeland Security have all talked about managing this surge. I hope that we never have to stand up field hospitals and additional facilities. I hope we don't get to that day, but we're prepared to go there if we need to. But what we are doing today is going to in part determine that. And so that's why we're taking these, some way think of them as remarkable or extraordinary steps, but they are absolutely needed, and we don't need to look further than some of our neighboring states or countries that we do business with and care a lot about as well. Let me also just state, I want to give a couple more shout outs to folks around the state of Indiana in addition to our mayors. These are 3 leaders representing, cities on I-69. We do intend on having other leaders, maybe on I-70 or 74 or 65, representing different sides, because this COVID-19 is not just about our biggest cities in the state. It's about small, medium, suburban, urban, rural. It affects us all. And when I think about some of the toughest among us, that's the Hoosier farmer. These are folks who know about preparation, that know about what 2 weeks means to the next 2 weeks, to the next 2 weeks. I'm just so pleased to see so many examples of generosity that are out and about our state. The American Dairy Association of Indiana has been out at the Indiana State Fairgrounds here in Marion County, passing out gallons of milk. Usually to get to the kiddos, they're passing out little cartons of milk. But we want to stress that now that kids are at home, we want to get more milk in the hands of the families that need it the most. And we're getting it to daycares. We're going to be standing up one of these facilities this Friday in South Bend, Indiana. And by the way, there is no shortage of milk. There's plenty of milk available. So we want to stress that. Our dairy sector can stock the shelves in our groceries. We want to make winners drink milk. We know that here in Indiana. We want more people to drink milk. Also, the Indiana pork, to them, we are so appreciative. They have donated 500 pounds of ground pork to the Wheeler mission already, and the hams that they will deliver will be devoured on Easter Sunday. The Belstra Milling up in northwestern Indiana, up in the region, have donated just over 1,600 pounds of ground pork to a food bank as well up in northwest Indiana. To the Heritage Ridge Creamery, they have donated 17,000 pounds of cheese to Second Helpings. 17,000 pounds of cheese. So these folks are all stepping up. And to one individual in Jay County, Indiana, Roger Locker, went out and purchased 300 dozen eggs from a local poultry farm, and he's giving them away to families that are in need. So these are our agriculture sector has long been our state's original calling card, for over 200 years, since we were forging our way out of the forest. And still to this day, they are stepping forward and having an impact on the most vulnerable, making sure that our communities are all stitched together, and every mouth that's in need is being cared to. And with that, we'll go to the line of questioning.
Rich Nye, WTHR.
Good afternoon, Rich.
Good afternoon, Governor and Mayors. Both these questions may be for Dr. Box, but are we any closer to having any kind of numbers on recovered cases from positive tests? And also, what were the results, if any, that you can report on setting up alternative care facilities and where those might be that we're going to have site surveys over the weekend?
Both very good questions. Are we closer on reporting the number of people discharged from the hospital or recovering from COVID-19? Not exactly. We are in the process of starting to glean that information through IHI and discharge data from our hospital systems across the state. There are a couple of pockets in the state where we don't get that data, so we're working to get them on board. And I would see that information, I would hope, coming out next week. There was also data that was requested with regards to ethnicity and race, and I'm hoping to have that posted and discussing that on Thursday or Friday of this week. With regards to looking at alternative care sites, we're working with different regions across the state. We've already identified a few that regions think are important and do not have those reports back yet, but our National Guard and then our Army Corps of Engineers will be reporting that out in the next, I would imagine, 48 hours to us.
Thank you, Rich.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor. Thank you so much for this. I'm trying to find out, is there ever going to be a time with Lake County, Indiana now having the second highest number of COVID-19 confirmed cases, are we going to get any information in regards to individual cities and towns? Because with Lake County being so spread out and not having really one central big city, You don't know where those hot spots are from Whiting all the way to Lowell. That's a really big area. Not sure if we're going to get those numbers, but I thought I asked.
We've been collecting that data and analyzing it by county. I will ask my team specifically. They actually watch every day to see what questions I get asked. So if that's data that we can start to glean and give you with regards to county-specific zip codes, we'll do that.
Emily Hopkins, the Indianapolis Star.
Good afternoon, Emily.
Good afternoon, and thank you so much for taking some time to answer some questions today and every day. Sure. I'm going to ask you to just think back way, what seems like years ago, to the beginning of March and late February, as we were still just watching. Some states had cases, very few states had cases. Indiana did not have one yet, one confirmed case yet. What were some of the specific things you were weighing at the time as you were making the decisions around social distancing orders? What balance were you trying to strike, and has anything changed since then, considering that Indiana was one of the earliest states to adopt a stay-at-home order? And then I have one more unrelated question if I have time.
You want to ask that one, and I'll write it down, and I'll get to both of them?
Sure. So the other question is, we're seeing some people congregating outside. We were wondering if there's any concerns as the weather gets nicer, and if the state will step up any kind of enforcement in response to that.
Second question is yes, if we need to. The answer, that was the whole point of the executive order yesterday, and Judge David Cook's presence and our superintendent of state police. We are jointly mindful of the whole state, not any one section, and we're working in partnership with local law enforcement and our local county health departments. The first question is, we were watching this before February. I mean, March 6th, as you allude to, Emily, was, yes, our first positive COVID-19 case, 16th being our first fatality of March. But we were looking at this at the end of actually last year. The world was talking about this coming at the end of last year, and we were tracking that wave country by country before it ever hit a county in America. And we factored in lots of things. We factored in what was happening, when it was happening, the number of cases, the number of positive tests, the number of counties, the number of ICU beds, adult beds, being taken, what kind of capacity, what was our equipment status, our inventory, starting to put together our task force, standing it up. Obviously, we had a influenza or a flu plan in place with the Department of Health, so this was nothing, we didn't have to recreate the wheel, so to speak, but we did have to stand up a much more robust effort. Mayor Henry, Mayor Hogsett, Mayor Winnicky all talked about just how essential the communication efforts were. That's why we've said we'll be here every day. We're in this for the long haul, but we continue to adjust, whether it be tweaking an executive order or adjust to, in terms of our behavior patterns, to what's necessary. And we understand through talking with other governors, talking with our federal partners, our local partners, we understand that what we're doing today has a direct, whether it be positive or adverse, impact on where we will be 2 weeks from now. And so that's why we continue to, in an hourly fashion, not just month by month, but in an hourly fashion. And that's why we're so grateful, quite honestly, that so many folks, we talk about a national strategic stockpile. We have a state strategic stockpile too. We have a local strategic stockpile too. It's called our Hoosiers and their generosity and what they're doing to turn or convert a business model to supply our local needs to meet that demand. And I can tell you, that's why I referenced just a few moments ago that we have a plan in place that goes to the extreme. I hope we never get there. And I can tell you one way that if we don't get there, it will be because of our conduct today. So there couldn't be probably, I don't think, a more important question than what you just asked. What were we looking at? And quite honestly, as the first question I think Rich asked about recoveries, yes, we're going to look at who's on vents, who's in the hospital, when did they get there, did they go on a vent, when did they get out, and how are they recovered, that whole cycle. And that's what my colleagues, governors across on the West Coast, East Coast, are dealing with as well. So we're all learning from each other, and we'll continue to make adjustments along the way.
Eric Berman, WIBC.
Yes, Eric. Good afternoon. Unmute your phone, Eric.
Eric will return to
Or
you.
not.
Amanda Bridgman, Warsaw Times Union.
Hello, Amanda.
Hi, Governor. Thanks for taking my question.
Sure.
Kosciuszko County has more than 100 natural lakes and is part of the lakes region of north central Indiana and home to the deepest and largest natural lakes in all of Indiana with a total of 15,740 acres of lakes in our county. The piers are going up in Winona Lake, and Syracuse nearly doubles in size during the summer months. If schools are closed for the year, assuming we shouldn't gather more than 50 people, how will that impact the recreational boating industry? And secondly, do you have any concerns about people who travel from out of state to their lake homes here and what impact that might have on the health of the local community?
Both very good questions. I think that when you see people out and about and they're on their boat and it's their nuclear family that they live at home with, they are exposing each other and together every day. So you try to social distance. Even I do that with my own family at home, but realistically, we live together, right? So I have no issues with that with regards to the lakes. What I would take issue with is everybody being gathered on the pier for a party or in the bar to, celebrate at dinner time, or, how we have one barge next to another, and everybody's kind of enjoying all that time together. That's where we're going to have issues with this. So this solitary, more quiet, smaller groups of people that go out to enjoy the outside, I wholeheartedly endorse and think that's really important. I do think that your question about a lot of people coming in from all over the state and maybe even from other states is concerning. And I understand your concern about that. Once again, I think if they launch their boat and go out and just hang out on their boat and then fish a little bit and come back in and leave, I don't see a big issue with that. It's when everybody's congregating in campgrounds and other areas together that's the biggest issue.
Yeah, I would say, Amanda, also, if you're traveling to get home to Indiana, we welcome you, we'll help you. But you shouldn't be traveling across state lines unless it's for essential business. So you shouldn't be coming to take in one of our state parks. And if we get to the point to where we need to take another step, we will. We're going to continue to support local authorities as well as they manage these. We're not in this to try to micromanage. We're here to partner with one another. And if a local mayor or a town manager sees that folks are congregating at the pier or on the dock or at the clubhouse, that's not what we're about. That's not 10 people. That's not your nuclear family. I'm telling you, this next 2 weeks, we just reported on 34 fatalities today. Make a list of your 34 best friends, and then imagine putting a line through them. That's how serious this is. This is not a time for partying. It's a time to hunker down.
Nikki Kelly, Fort Wayne Journal-Gazette.
Hello, Nikki. Good afternoon.
Governor, how are you?
Good, thank you.
I just wanted to ask Dr. Box, a lot of the new deaths you're reporting are actually attributed to days before, maybe a week or two ago. Mm-hmm. And in recent days, we've actually seen very few new cases, and I'm just wondering if there's anything positive we can take from that.
Oh, I'd love to say that, but I think we'd be stretching that right now. Unfortunately, I don't think we've seen the peak in our deaths. I think that, we report the deaths as they come in and they're reported to us. Then if you look on our website, we're trying to be very careful to make sure the deaths that the day they occurred, that it's actually attributed to that day, because from an epi standpoint, that's really what we want to be looking at. But I do think that, we still continue to have some lag in the reporting of these deaths, and it has been concerning to me, especially with regards to our long-term care facilities. So I want to continue to say those need to be reported immediately.
Tyler Finnick, Indianapolis Recorder.
Yes. Hello, Tyler. Good afternoon.
We will return to Tyler. Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. What steps is the state going to be taking to address what seems to be a continuing increase in cases and deaths down in southeastern Indiana in a rural area? And then what was the reasoning for your new executive order of not allowing counties to impose more stringent travel restrictions?
Take the first one first.
Sure. So that's part of the reason we announced some drive-through testing that we want to get done later this week with regards to southern Indiana. We have partnered in Clark County, we have partnered in Ripley County and several other counties there to assist them in any way, shape, or form that they need. We've actually been out to those counties to talk to them. We are continuing to make sure that we partner with them so that they know that they can get testing done for individuals that need to be tested, supplying PPE if needed. We know that those are rural areas, and our smaller hospitals and some of our smaller EMS do not have access the way some of our larger hospital systems and larger EMS systems do to PPE and other testing.
Joe, you want to talk about the balance between the state and the local partnership and with the EO? Thank you.
Was the question pertaining to travel advisories and the?
Just the local authorities, their measures that they put into place in the state
Yes.
authorities and not superseding or trumping their authority.
So there are approximately 1/3 of the counties in the state that have adopted travel advisories. There's three levels of travel advisories, Steve knows from DHS, under Indiana law. You've got advisory, which is the lowest level, and it's simply when a county adopts it, directs individuals to use caution. The second level is watch, the watch level, and that is essentially provides that you should only be out to do essential travel to work, to stores. It lines up very nicely with the executive order that both the last one and this one that the governor has adopted that goes into effect today. And then the highest level is the warning level. And the warning level is very strict. It can deal with emergencies only. And part of the issue is there's only 2 counties in the state that have adopted the warning level. And the issue can be as people move back and forth across county lines, there's different rules. And so the thinking was at this point, and this can be adjusted moving forward, for consistency's sake, this lines up best with the executive order that was adopted and is going into effect tonight.
Thank you, Joe.
And for our last question, we'll return to Eric Berman, WIBC.
Hello, Eric.
Hello, Governor. Glad we got it working this time. Dr. Box, my question is for you going back to the very beginning. When we talk about the strike teams visiting the long-term care facilities, how many facilities are they able to get to in a day? What exactly are they doing when they get there? And what's our concern in terms of these cases leapfrogging out of that contained facility into the community at large?
So I'll answer the last part of that first. Most of these cases in long-term care facilities are brought in from the outside by individuals who work there, whether that is preparing meals or the CNAs that come in or the nurses. And I have no blame there for them. We've asked them for many weeks now. When this very first started, we asked them to mask themselves so that we could protect our individuals and residents that live in these facilities. And they, for the most part, have been doing that. But we know a significant number of people are out there and may be COVID positive, and they're not even aware of it. So that's how it can be spread, and that's kind of the CDC's general recommendation now about masking yourself when you go out into public so that you don't infect other people when you may be asymptomatically positive. With regards to our strike teams, our strike teams started with the hepatitis A outbreak around the state. And so it was kind of our trial run. We started with 3 strike teams. We grew to 5 to 6, and now we're at 11, one for every preparedness district. And probably realistically will grow by another, 5 to 10 over this next week period of time. The goal there was to make sure that individuals could be tested in the long-term care facilities, in the residential facilities, so that they didn't have to be moved to a hospital system to be tested and sit in an emergency room where they might actually get sick with COVID-19 if they didn't have it, so that we could get out there within 12 to 24 hours and test those individuals and immediately start to work with that facility when we knew they had a positive. We had already been out to all of them, given them information about infection control and COVID-19 and signs and symptoms to watch for. Our nurse surveyors had been to every one of the over 500 long-term cares and over 200 residential facilities. But we've also gone back out when we know someone needs tested. We're testing that individual that is sick and other individuals that live and are around them, the employees that are there, and then when there are positives, we're there with further information about how they can isolate these individuals and how they can cohort these individuals, and how there may be other individuals that are asymptomatic but have been in that closed-in area with them and could potentially show up positive. And so they may need to be separated from the positives, but also still kind of separated from that part of the facility that has no cases. So there's been a lot of interaction, and there will continue to be that amount and probably more going forward as we support our long-term care and residential facilities.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.